The Guilford Press, in association with Riverside Digital Productions, presents Motivational Interviewing in Healthcare, Helping Patients Change Behavior. Second edition, by Stephen Rollnick, William R. Miller, and Christopher C. Butler. Narrated by David Josefsberg, Booth Daniels, Allison Posner, Michael Quinlan, Keyondra Shanae, Juani Tantillo, Brad Ziffer. Published by the Guilford Press, a division of Guilford Publications, Inc. Copyright 2023. Publisher's Note: Thank you for purchasing this Guilford Press audiobook. This title has supplemental material which includes all of the figures and tables referenced in this audiobook, as well as the table of contents, appendix, and references. To download the PDF, go to the following URL: www.guilford.com/MIH. There are sections in the text called Try This or Test Yourself, where you, the listener, are prompted to consider an example or answer a question. We suggest you pause the audiobook when you formulate your response, then hit play when you are ready to continue with the text. Preface. This second edition of Motivational Interviewing in Healthcare is written for frontline practitioners. Whether you're a nurse, doctor, physical therapist, social worker, occupational therapist, dentist, diabetes educator, psychologist, behavioral health practitioner, or service manager. This book is about how to conduct skillful conversations that make a difference in people's lives, particularly when the focus is on why or how they might change. It has been completely rewritten by the co-founders of Motivational Interviewing, MI, and contains a new framework along with practical ideas, skills, and strategies for improving clinical practice. Since the first edition of this text was published in 2007, the amount of research on MI has increased eightfold, including more than 1,700 clinical trials on a broad range of health topics. MI has been used to improve health behavior and lifestyle change outcomes against a background of a rise in long-term conditions like diabetes, heart disease, tuberculosis, and HIV/AIDS. Our grasp of how best to use MI in healthcare has been further tested and refined in clinical practice and practitioner training workshops. In this second edition, we use the simpler framework for MI offered in the third edition of the parent textbook, Motivational Interviewing, Helping People Change, in which we hope you will find accessible ways to tackle familiar challenges. The well-being of practitioners is so often challenged by pressures of time and outcomes. In this updated edition, we give more attention to helping get the process right inside the consultation so that you feel less rushed and more effective. Making a transition from fixer to guide relieves you of the stress and weight of having to solve behavior change issues for patients and instead help them do this for themselves. In so doing, outcomes can also improve, along with your enjoyment of everyday practice. What might you look for in this second edition? We address the merging of skillful advice giving with MI, helping you blend your professional expertise with evoking your patient's own wisdom and motivation. There are also new practical suggestions for offering not just praise, but affirmation in everyday practice. There are chapters on how to merge assessment with MI, on very brief consultations, on how to run groups that are based on MI, and on how service managers can support the use of MI by making the front end of care more user-friendly. At the heart of this book is clinical dialogue with commentary for getting the best out of scenarios that crop up every day, such as talking with a patient who feels reluctant to change, encouraging someone who lacks confidence, and raising the sensitive subject of change in the first place. We are mindful, too, of the rewards and challenges of working on the front line in marginalized communities, where patients face such daunting threats to their health and obstacles to change. There is hardly a medical condition in hospitals or community settings where the way people live their lives and the resources available to them do not directly impact their health and recovery. We hope this book will help you to feel more confident to work across boundaries of language and culture, because we pay careful attention to practical steps for engaging with people in an efficient manner, often under time constraints. The book contains numerous examples of practitioners speaking with people across cultures. The route to success is a very basic guideline. See this as a person first, patient second, and show them that you care. Then you can
Sample complete. Ready to continue?